My name is Dr. David Neighborly. I'm the head of ophthalmology at Vancouver General Hospital, and I'm also a practitioner here in the area of the diseases of retina and vitreous. Here at the Eye Care Centre at Vancouver General Hospital, my colleagues and I perform over 5,000 surgeries a year. Many of these surgeries can restore vision in patients who are blind or severely sight limited. However, there are many conditions that we're still unable to correct. One of the leading causes of vision loss that we see is macular degeneration. It affects over 80,000 Canadians. Thanks to donors like you, the third floor of the Eye Care Centre has been redeveloped into a Centre for Macular Degeneration Research. Scientists there are working towards a cure for macular degeneration.
My name is Joanne Matsubara, and I'm the Director of Research here at the Eye Care Centre. I'm also a founding member of the Center for Macular Research. I study age-related macular degeneration. Today I want to tell you about some of our very exciting findings in the dry form of the disease. Dry form is the early stage of age-related macular degeneration. What we're very interested in understanding is why the early stage of this disease progresses in some people to the more severe forms and thus cause eye disease, and why the early stage does not progress or remains quiet and calm in other people. While the research we are doing on AMD is already being beta tested on patients in the Eye Care Centre, we found by taking a small blood sample from AMD patients, we can test their genotype as well as the cytokines circulating in their blood. These two biomarkers help us to understand the progression of AMD disease in individual patients. Much of our research is focused on personalized medicine, which means that doctors will be able to treat individuals depending on their unique level of chemicals circulating in their blood, for instance, as well as their genotype. If all goes well with our research, we expect that this type of testing for AMD progression will be used in patients in the next 2 or 3 years.
My name is Dr. Cheryl Evans. I'm an associate professor in the Department of Ophthalmology at UBC. So my research principally involves looking at childhood diseases, trying to find the genetic causes, and then using novel treatments to reverse the genetic defects. We use 3 different model systems. We use zebrafish, we also use standard mouse models, and we're about to set up the lizard model system. Lizards actually have an eye that is somewhat similar to humans and is better for modelling macular degeneration. And so we're very excited to be setting up this new facility. We're grateful that the department has given us the opportunity to do that. Our whole approach is to essentially look at very difficult conditions that children are born with and try to find ways to improve their prognosis, because currently the treatments are very, very limited.
I'm Dr. Orson Moritz. I'm an associate professor here in the Department of Ophthalmology at the UBC Eye Care Centre. One of the goals of our research program is to determine whether in these genetically inherited disorders, particularly retinitis pigmentosa, when there are different genetic underlying causes, are they really the same disorder or not? One of the sort of unusual things about this research program is that we are using genetically modified animal, which is the Xenopus laevis frog. In terms of when would our data become useful for ophthalmologists treating patients, in some cases, there are certain projects, one project in particular, where we're studying a drug that's already being tested in clinical trials, and our data suggests it may only be useful for certain types of RP patients. I would imagine that data would become useful as soon as it's published, so in the very near future.
My name is Professor Kevin Gregory Evans. I'm one of the principal investigators here at the Center for Macular Research. My research is focused on finding new treatments for retinal degeneration, and we're undertaking that work in 2 slightly different ways. One is a pharmaceutical approach to treatment to try and inhibit progression of disease, and secondly a stem cell approach to try and reverse blindness once it's already become established in the eye. We're hopeful here at the Center for Macular Research in Vancouver that we'll be able to start clinical trials in patients with macular degeneration within the next 3 to 4 years.
Donors like you support scientists that create discoveries at the Center of Macular Research. These discoveries eventually make it downstairs to the clinic space at the Eye Care Center, where my colleagues and I can actually use them to take care of patients. Thank you.